Okay, so hello. And so today we're going to talk about your exfoliative cytology. Okay, and so you have your exfoliative cytology. And so actually, your exfoliative cytology is part of your diagnostic cytology. And so your diagnostic cytology, it includes your exfoliative cytology and your fine needle aspiration, no? Aspiration, okay? And so your diagnostic cytology, that is actually your microscopic study and so microscopic exam of your cells from different body sites for diagnostic purposes. Of course, you have still your clinical correlations in here, okay? And so while your exfoliative cytology and so your exfoliative cytology deals with your microscopic study of your cells that spontaneously shed off. No, and so you have here your microscopic study of your desquamated cells from your epithelial surfaces. While for your fine needle aspiration, ayan, so your fine needle aspiration, ayan, so that is for your cells that do not spontaneously shed off. Okay, and so for that, in your exfoliative cytology, your sample is you have your exfoliated cells, of course. And so you have your exfoliated cells. They are found in smears through your spontaneous shedding of your physical removal or from your epithelial cells and mucous membranes, no? Like your buccal cavity, your body fluids, and so your vagina. And so your spontaneous exfoliation, and so your exfoliation is observed from your normal cells. And so normally we shed off what we call this, we shed off squamous cells, epithelial cells. No, but then in cases of malignancy or you have a neoplasia, ayan, so the shedding or the exfoliation of your cells is relatively at a faster manner. And so again, normally we shed off cells. We shed off epithelial cells. Kasi nga, there is growth. Ayan, so in reproduction, there is a continuous or constant growth and reproduction of our cells. And so, but then in cases of your neoplastic cells, the growth and reproduction of these cells are relatively faster, sorry, comparing it to your normal cells. That is why, ayan, so this in cases of neoplasia, ayan, so or there is malignancy, then there is a relatively increased amount of exfoliated cells. Okay? Again, ayan, so your FNA, your fine needle aspiration, it does not, ayan, so that is for your organs that do not spontaneously shed cells. Okay? So let's take a look at your cytopathology and your cytotechnique. Okay, and so your cytopathology, and so that is the study of your abnormal cells. Still, for your cytopathology, there is a clinical correlation. And then for your cytotechnique, and so that is the method or cytotechniques, if you want, then that is the method or methods of preparing the cells for microscopic exam. Okay, and so that is in your cytotechnique, that is you have there your smear preparation, fixation, staining, and the rest of the techniques involved. No, and so this is just the same with your histopathology and your histopathologic techniques. Okay. Okay, and so let's take a look at the importance of your exfoliative cytology. And so these are used and so important for the detection of your malignant cells, no? And so for the detection of your malignant cells, of course, that is in your from of course the sample from the source of the sample. Now, of course, if that is from your cervix, from your cervix, then of course that is for the detection of cancers from the cervix, no? And so but then and so in case of your paps cytology from your pap smear for your vagina, and so accordingly that is screening, no? And so that is screening. Okay, and so also this exfoliative cytology is used for staging of your cancer, and so that is used for staging of your cancer, and then also used for the detection of your potential cancer on your cervical lesions, no? And so for detection of your cancer on your cervical lesions. Accordingly, and so for women, and so they have what they call this. They have at some age, and so they should be what they call this doing a pap smear at a time interval. Okay, and so for this one, for the detection of your potential cancer cervical or cancer cervical lesions. No? And then for assessment of your female hormonal status, you have actually your vaginal hormonal cytology with that. And so accordingly, and so your hormonal status, and so that is important for your sterility and endocrine disorder. No, and so that is for sterility and endocrine disorder. No, ayan, and then of course you have here the samples for your this one for your assessment of your female hormonal status is from your lateral vaginal walls. No, ayan, so lateral vaginal walls. And then of course determination of your genetic sex. And so this one of course your genetic sex, and so you have your true sex. And so because you have actually for females, and so even actually in males, no, and so you have but then for females, for this one, and so you have for females, they have this extra chromosomes, no? And so you have this extra Y, extra X, or whatever with that. No, and so with that, and so determination of your true sex or your genetic sex, and so relatively for females, they have this. I mean, for females, they should have two X chromosomes, no? And so this one is actually accordingly what they call this, your females accordingly exhibit a conglomeration of chromatin. And so a conglomeration of your chromatin in the nucleus. And so that is described as bar bodies. Okay. And then of course, detection of your infectious agents. No, and so for this, and so in your exfoliative cytology, you are not only dealing with the shedded, the desquamated cells, but then you will also, what you call this, check on, ayan, so the different microorganisms present. Okay, and so you have there in your, the presence of fungi, no, in your smear. And so the presence of your bacteria, okay, those items. And then, of course, to differentiate tumors from other diseases like your inflammation, no? And so inflammation or infection, probably. And so for that. Okay, and so that is for your importance of your exfoliative cytology. Let's take a look at your fertility and then your sex determination. And so this one is part actually of your importance still of your exfoliative cytology. No, and so your fertility, of course, this one is the ability for reproductive function. And so in your vaginal hormonal cytology, and so this one is being observed. No, and so the fertility, this one is being if you rule out if the sterility of an individual, no? And so usually this is determined by the assessment of your hormonal status of a female. And so in case of your vaginal hormonal cytology. And then your sex determination, again, you have your true sex for females, you have your XX chromosomes. And so and then, of course, with it, the association of your bar bodies with this XX chromosomes. No? And so the specimen from your buccal and vaginal mucosa from the lateral walls of your vaginal mucosa. Okay, and so you have your true sex again is determined based on the presence of your conglomeration of your chromatin. No, and so that is your bar bodies. No, and so, and then of course, this one is important in your field of genetics. Again, kasi nga, you have, some individuals possess extra chromosome. Maybe, I mean, not only the females, but also for the males, no? And so, those items. Okay, and so let's take a look at your samples for your exfoliative cytology. Okay, and so you have your scrapings and your aspirates. And so these are from your lining, epithelium, and mucosa of the female reproductive tract. No? And so you have there from your vagina, from your cervix, and from your endometrium. your scrapings, and your aspirates. Now, and then you have your prostatic secretions. And so you have your, that is actually done through massage. Massage of your prostate via your intrarectal route using your index and middle fingers. No, and so that is for that. And then your bronchial secretions or your sputum. And so you have to be, it has to be deep cough. And so you have your bronchoscopic, and then of course your bronchoscopic aspiration. And so these are actually your bronchial secretions. Actually, they are done using your bronchoscopy. Okay. Then you have your gastric contents and your duodenal fluid, okay? And so they are obtained by intubation technique using a narrow, actually a nasogastric tube. And so you have your gastric contents, they are watery acidic fluid and would with food debris. No, and so but then there should be no food debris present. And then you have your duodenal fluid, that is your greenish yellow alkaline, and so that is greenish yellow and it is alkaline and mucoid. Okay, and then your CSF, and so your lumbar top done on your intervertebral spaces between your third and fourth. And so a correction with that, that is between your third and fourth lumbar vertebrae, or your fourth, between your fourth and your fifth lumbar vertebrae, and so, or your L4 and L5. Okay, and so again, you use your Vim Silverman needle, and then 1 ml or 1 cc of your CSF fluid is necessary. Of course, because this one, and so of course your CSF is relatively difficult to obtain. Okay, but then if there is an effusion, relatively this one is already pathologic. No, ayan, so it's with that. Okay, and so your CSF, this one is located in your subarachnoid space. No, ayan, so your CSF, this one is located in your subarachnoid space. Okay. You have here your cell suspend, sorry, your pleural fluid. And so your pleural fluid, your pericardial fluid, and then your bone marrow, your urinary sediments, and your skin scrapings. No? Ayan. So, but then for your pleural fluid, ayan, so this is by thoracentesis on the left lateral thoracic wall. And then your pericardial fluid by your pericardiocentesis on your left sternal border. And so your pleural fluid, this one is from your pleural cavity, your pericardial fluid from your pericardial cavity, and then your peritoneal fluid, or this one is otherwise known as your ascitic fluid, obtained by paracentesis in your abdominis at the linea alba. Okay, and so this one is all otherwise known as your ascitic fluid, or they are found in your peritoneal cavity. And then, of course, you have your bone marrow, you have your skin, urinary sediments, and your skin scrapings listed. Okay. Okay, and so let's take a look at your gynecologic samples in a more detailed one, no? And so these are from your, what you call this, your endocervical and your ectocervical mucosa. And so that is your, accordingly, most cancer arise from the junction of your endocervical or your ectocervical mucosa. That is at your T zone, no? And so again, most of your cancers arise from the junction of your endocervical and ectocervical mucosa or your T zone. And so relatively, and so your site of the sample should be at this one, no? And so your collection, accordingly, sorry, your T zone sampling is important for the detection of your cervical malignancies. Okay, again, your T zone is important for the detection of your cervical malignancies. Okay, and so you have here your sample should be your squamous cells, columnar cells, and metaplastic cells. Of course, this one in case of in case there is a neoplastic cells. No, ayan. So you have here your collection is via your brushing. No, ayan. So you have your endocervical brush. Ayan. So that is for samples of your endocervical canal, your vaginal scrape. Ayan. So that is, this one is used for patients with hysterectomy. your lateral vaginal scrape, ayan, so for hormonal evaluation, ayan, so vaginal hormonal cytology, na nabanggit natin yan kanina. And then four quadrant scrape, vaginal scrape, your four quadrant vaginal scrape, ayan, so this one is for the localization of your vaginal adenosis. And then your vulvar scrape, ayan, so for the detection of your herpetic lesions or cancers. Of course, for your herpetic lesions, you have your simple herpes simplex. Okay, and so that is for your gynecologic sample. Okay, and so again, your vulvar scrape, and so for the detection of your herpetic lesions or cancers. Still your gynecologic sample. No, and so accordingly, and so some patient preparation, and so you have here the patient accordingly should abstain from sexual intercourse. No, and so should abstain from sexual intercourse, and so do not what they call this, do not douche for at least a day, and then do not apply intravaginal preparations, no? Ayan, so for at least 1 week before the exam. Okay, and so for that, ayan, so do not apply intravaginal preparations for at least 1 week before the exam for what you call this, and do not wash your vagina for at least, I mean, do not douche your vagina for at least 1 day, and then of course, abstain from sexual intercourse, no? For again, and so, and then of course, your collection of your gynecologic sample should not be done during menstruation. And so should not be done during menstruation because and so the bleeding and so contamination with the blood will what and your what you call this will obscure the cells during smear exam. No, instead that you are looking at the malignant cells, but they are being obscured by your blood cells and other endometrial components. No? And then, of course, you have here, accordingly, your brush biopsies are what they call this. This brush biopsies produces more endocervical cells and blood may be present in the smears. No, ayan, so it produces your brush biopsies, produces more of your, I mean, yes, and so collects more of endocervical cells and blood. Okay, and so this one will cause a presence of your blood in the smears will be difficult in evaluation. Okay, and then you have your wooden spatula. Okay, and so accordingly, and so your wooden spatula is preferred over plastic spatula. Okay, and so your wooden spatula is preferred over plastic because it has a rough surface and can collect more and so of the material for exam. Okay, and then of course the use of your cotton swab for collection of your cervical smear is discouraged, no? And so this one is discouraged due accordingly for drying to the because of its drying artifacts and loss of cells. And then, of course, your endocervical brushing. And so this one is what they call this. Your endocervical brushing is used strictly for taking materials from your endocervix. Okay, and so this one, your endocervical brushing is used strictly for taking materials from your endocervix. Okay, have your respiratory sample. Okay, and so you have your respiratory sample. This one, of course, is used and so to rule out the possibility of malignancy or infectious agents. No, and so this one, accordingly, your respiratory sample for what they call is usually requested for patients with immunodeficiency diseases. Okay, and so again, to rule out the possibility of malignancy or infectious agent, of course, your common infectious agents present in your uh, that infects your what do you call this, your lungs, no? And so aside from those, you have there your to rule out the presence of your pneumocystis carinii, uh infection, no? Ayan, so for your respiratory sample, and so this one, they are collected using actually your bronchoscopy. And so done using your bronchoscopy. Okay, and so you have actually here your samples for your respiratory sample. You have your bronchoalveolar lavage, your bronchial washing, and your sputum. Okay, and so you have here. And so usually the most common is of course your sputum. No, and so for the collection of your sputum, you have here for your three consecutive morning samples. No, and so three consecutive actually. And so this is for this one morning sample, this one is also the same with the preparation for DSSM for direct sputum smear, no? Ayan, so in case of tuberculosis, parehas lang siya. Morning sample, deep cough. Ayan, so yun. Okay, and so three consecutive morning sputum. And then, of course, it should be deep cough. Ayan, so if hindi kayang umubo, then accordingly, you use something that will induce coughing, and so to induce uh cough, no? And so accordingly they use inhalation, and so in aerosol solutions for 20 minutes, and then of course it will induce cough, no? And so again, you have three consecutive morning sputum here. Okay, ayan, so you have here, and then of course you have your bronchial washing and your bronchial brushing. And so in your lavage, of course. And so your bronchial washing, bronchial brushing, and so the smear accordingly is prepared via pull apart technique. And so the smear is prepared via pull apart technique. Okay, and so again, for this, and so your bronchial washing and bronchial brushing and lavage, and so you use your bronchoscopy. Okay, and then of course for this one, and so your for your sputum, ayan, so it should be deep cough again, ayan, so that the sample is a true representative of sputum. Ayan, so if that is a true representative of sputum, then there should be a presence of your alveolar macrophage. If there is no alveolar macrophage present in the sample, then the sample is just saliva. And again, the sample should be as fresh as possible, no? And so of course with this, and so you collect in a wide mouth vial with, and so you collect in a wide mouth vial. Okay, and so for your sputum, and so you collect in a wide mouth vial with Sacomano fluid. And so your Sacomano fluid is a mixture of your 50% ethanol and 2% carbowax. Again, ayan, so for the sample of your sputum, it should be three consecutive morning sputum and a deep cough. Ayan, so collected in a wide mouth vial containing Sacomano fluid. Okay, containing Sacomano fluid. Ayan, so your Sacomano fluid that is made up of 50% ethanol and 2% carbowax. Have your gastrointestinal sample. Okay, and so you have your gastric lavage, and so done using your gastric lavage, gastric brush, or fine needle aspiration. Okay, and so gastric brush, gastric lavage, or fine needle aspiration. Accordingly, and so it is just the same with the collection in your respiratory specimen. Okay, and so, but then this one, for your gastrointestinal samples, it requires 8-hour fasting. And so it require 8-hour fasting, no? And then you have your serous fluids, no? And so your serous fluids, and so these are actually fluids, and so from your what they call this peritoneal, pericardial, and pleural cavity. And so they have actually, in case of fluid accumulation in your serous cavities, this indicate pathologic processes. No, and so with that, you use heparinized collection containers to avoid formation of jelly-like clots. No, and so you use heparinized collection containers to avoid formation of jelly-like clots. And so you use it, this one, your 300 units of heparin per 100 ml of sample. And then you have your breast secretion. Your breast secretion, and so this one accordingly, it has a low diagnostic what they call this, your breast secretion, it has a low diagnostic importance, no, ayan, so it has a low diagnostic importance. But then, ayan, so this one is in your spontaneous nipple discharge, usually that is a result of hormonal imbalance, okay, and so but then this one is also seen in cases of your duct ectasia and papilloma. No, and so if bloody, accordingly, and so if blood, the secretion is bloody, then consider a benign intraductal papilloma with this one. Okay, and so that is for your breast secretion. Of your urinary tract specimen. Your urinary tract specimen. And so this one is used for urothelial malignancies. And so of course, hindi lang naman not only for your urothelial malignancies, but then there are what we call this pathologic infectious microorganisms present. No, and so with this, and so your early morning sample yields the greatest number of cells accordingly. But then, and so due to overnight storage, no, overnight stay in the bladder, and so there is a degeneration of cells. Okay, and so the urine sample that is preferred in your urinary tract specimen for cytology is your second urine. Okay, and so your second urine. Okay, and so you have there your second urine. Okay, and so for your females, and so catheterized sample is accordingly preferred uh over over your clean catch accordingly. And so to what we call this, avoid, and so contamination with vulvar cells accordingly. And so with this, and so you have your 50 ml sample is recommended. And so your volume of the sample for urinary tract specimen urine cytology is your 50 ml sample. And it should be accordingly two samples should be submitted. Ayan, so one in the morning and one later the day. And so that is for your cytology, urine cytology. Okay, and so let's take a look at your fine needle aspiration. Of course, this one, ayan, so is used for the study of samples obtained from organs that do not spontaneously shed off. And so comparing it, of course, to your what they call this, comparing it to your exfoliative cytology. And so examples of this, and so examples of organs that do not shed cells, you have your thyroid, your lymph nodes, your liver, your lungs, your skin, and so your soft tissues and bones, and so your breast, and so those items, okay? And so this is actually useful in lesions that are easily palpable. And so this is actually useful in lesions that are easily palpable, like the growth of skin, subcutaneous soft tissue tumors, thyroid tumors, lymph nodes, salivary glands, and breast, no? And so basically, and so generally the fine needle aspiration uses 25 gauge needle and a 10 ml syringe. And so this one is for general. Okay? And so let's take a look at your palpable masses. And so for your palpable masses, and so it uses a gauge of 22 to 23. And so you have a gauge of 22 to 23 here. Ayan, so a gauge of 22. And so this is the same with the needle gauge that you used in your venipuncture, in your phlebotomy, no? And so with this, and so the size of the syringe depends on the depth and potential fluid content of the lesion. Okay, and so the size of the syringe depends on the depth and potential fluid content of the lesion. And so if there is more than if there is a lot, there is more fluid present, then you use more of, a greater volume. No, and then you have your for non-palpable masses, and so this one is for your For your non-palpable masses, like your organs that are situated below, and so that you cannot palpate, and so you have here, they use actually your fluoroscopy. And so they use your fluoroscopy, your computed tomography scan, your CT scan, your ultrasound, and of course use of other appropriate radiologic technique here. Okay, and so you have here you have again your fluoroscopy, your CT scan, and your ultrasound. Okay, and so for your cystic masses, accordingly, and so if you already obtained a sample for your cystic masses, and so do not add fixative. And so you bring the sample to the laboratory as is accordingly. For your non-cystic masses, and so you prepare a smear and then you fix. You fix using your spray or your fixatives. Okay, and so that is for your fine needle aspiration. Okay. And so for your smear preparation of FNA, your fine needle aspirates, and so you have here if your specimen sample is bloody, accordingly if bloody, and so you prepare for slides, no, and so you prepare for slides using your pull technique, and so that is actually your wedge, no, and then you use 1 to 2 drops of a sample, and then you do your pull technique, sorry, and so just the pull, no, and so that is in case that your specimen is bloody. And then again, 1 to 2 drops of sample. And so for your transbronchial FNA naman, ayan, so you use 1 to 2 drops of sample and then pull apart. And so 1 to 2 drops of sample and then pull apart. Again, remember that your pull technique and pull apart is they are actually different, no? And then of course you fix in 95% ethanol or spray fixative, or you use your alcohol acetone or your formalin. And so you have your 95% ethanol, spray fixative, your what you call this alcohol acetone and your formalin, and so they accordingly produce the same result, no? And so that is for your uh smear preparation of your FNA, no? Your preparation, smear preparation for your exfoliative cells, no? I mean exfoliative cytology. Okay, and so of course, and so the sample should be a fresh material, no? And so should be fresh material. Ayan. So collected. Ayan, so collected, I mean, the sample should be of fresh material, no? And so for samples collected at the doctor's clinic, and so you have that should be sprayed right away, and so with fixative, and so they should be fixed right away, okay? And so spray, and so you have it should be of thin preparations, and so prepared thinly, even distribution in a slide. And then the smears for your cytological detection of your neoplasia should be air dried. Sorry, should not be air dried. Okay, and so your smears for cytological detection of neoplasia should not be air dried. And so should be avoid air drying should be avoided with smears of your cytological detection of neoplasia accordingly because it changes the appearances of the cells. The appearance of the cells are actually altered, no? But then for your BM slides, and so you do it same with your preparation of your blood films, no? And so again, for your this one, for your smear preparation, and so you right after smearing, and so you spray fixative, and so spray 1 foot away, and then again, the smear should be made from fresh material, even and should be spread evenly on a clean glass slide. And so should be frosted glass slide dapat. For that, and so that you can write, you can label, no, and so that you can label, and so like you can label on the frosted end, no, and so accordingly diamond kinemerlu, but then and so if in case of you have frosted end, kasi you can a pencil is good, no, and so pencil is good, the pencil lead, and so is good. And even if ilagay mo yan, you stain it, Ayan, so if saksak mo, I mean, if you stain that one, it will not absorb stain. Ayan, so hindi din siya mawawash off yung pencil, no? The label. Okay, and so that is for your preparation. Okay, and then you have your fixation, okay? And so you have your fixation of your cells, no? Of your smears, of course. And so you have here your immerse, of course, in a fixative or spray, no? And so, or your exfoliate, because, ayan, so immediate fixation dapat daw siya. Ayan, so because, ayan, so your exfoliated cells decompose rapidly. Ayan, so they decompose rapidly. Ayan, so you use your 50% alcohol for all types of effusion. Ayan, so accordingly, ayan, so for all types of your effusion, accordingly, you use your 50% alcohols. No? And so that is for that. Okay, and so your common fixative for your cytologic preparation, you have here your 95% ethanol. And so again, the fixation time, it varies accordingly. And so, but then for your 95% ethanol, and so you have 3 to 5 minutes. And so, but then again, it varies. The fixation time varies. No? Ayan, so the fixation time varies with this. Okay, and so you have here, again, if your smears, if you cannot, ayan, so prepare smears right away, then you use this 50% alcohol. Ayan, so 50% alcohol for all types of effusions. Okay, and so if you cannot prepare the sample immediately, then you what they call this, place the sample in a 50% ethanol for all types of effusion. And this 50% ethanol can be replaced using your with can be your 50% ethanol can be replaced with Sacumano fluid. Okay, and so again, you have your common fixatives for cytologic preparation. You have your 95% ethanol, your equal parts of 95% ethanol and ether. And so your methanol, your 80% isopropanol and your propanol, and then your denatured alcohol. Okay, and so with this, your 95% ethanol, and so this one actually is used, no? And so actually, again, and so your uh 95% ethanol, and so is actually uh used nowadays, no? And so your equal parts of 95% ethanol and ether, actually this one is actually the best fixative for cytologic preparation. But then, due to its hazard, and so it is what we call this flammable, volatile, and of course it poses fire hazards, then this one is not commonly used by laboratories, no? And so your equal parts of ethanol and ether, and so so this one actually the most commonly used is your 95% ethanol. Your methanol, this one is a substitute for your ethanol, and so but then it is uh it is more expensive, no? And so your methanol is a substitute for your ethanol, but it is more expensive. But then it causes less shrinkage comparing it to your 95% ethanol. And then you have your 80% isopropanol and propanol, and then your denatured alcohol. And so you have your denatured alcohol accordingly can be used, no? And so you have here your carbo wax is a fixative, a substitute for your wet fixatives. No, and so your carbo wax is your carbo wax or your polyethylene glycol, and so is a substitute for your wet fixatives. Okay, and so your slides, and so what they call this before staining, and so when you use carbo wax as a fixative, and so for your slides, and so your slides should be kept overnight in a 95% ethanol. Again, and so if you use carbo wax as a fixative, and so then you keep your before you stain, and so you place that slide, that smear in a 95% ethanol overnight, no? And so to remove the coating of fixative. Okay, and so to remove the coating of fixative. And then you have your carnoise fluid. And so this one is used to lyse your RBC in case of hemorrhagic samples. Your carnoise fixative, this one is used to lyse RBC, used to lyse. Can you just remove the D here? And so lyse RBC in case of hemorrhagic samples, no? And so this one, your carnoise fixative, and so this is an excellent nuclear fixative, and then it preserves your glycogen. But then it causes considerable shrinkage and overstaining in hematoxylin. And so your carnoise fixative, and so should be fresh. And so kapag gagamitin mo daw siya, it should be fresh. And so kapag old na siya din, palitan mo na. Okay, and so that is for your fixatives. Have here your cytospin preparation. Okay, and so you have your cytospin preparation for this one. Okay, and so accordingly, and so you use a centrifuge. The sample should be centrifuged at 1000 RPM for 1 minute. Okay, and so you centrifuge the sample at 1000 RPM for 1 minute, and then remove the supernatant, and then prepare your smear in a slide coated with egg albumin. Okay, and so that is your adhesive, no? And then fix in a 95% ethanol when accordingly the edges are dried. Okay, and so when the edges are dried and the center is relatively wet, accordingly you fix in 95% ethanol. Okay, and so in case of delay, in fixing or preparing the sample, then the sediment should be covered with absolute alcohol and placed in the refrigerator. No, and so in case of delay, again, and so the sediment should be covered with absolute alcohol and then placed in the refrigerator. No, of course, that is at a ref temp. Your cytospin preparation. Okay, and so this one distorts accordingly, your cytospin preparation distorts cellular morphology due to air drying. Ayan, so, and then of course, immediate fixation or use of equal volume of your polyethylene glycol for this one. Okay, and so that's still for your cytospin preparation. For your cell suspension, and so it uses 20 to 30 ml of sample. Okay, and so your cell suspension, it uses 20 to 30 ml of sample, and then the sample is viable up to 4 days at ref temperature. And so viable up to 4 days at ref temperature. And so if you cannot prepare the smear right away, the sample right away, then you can store it in the refrigerator. No, your effusions and watery lavage require concentration. And again, the standard method for concentration of your samples is through centrifugation. Okay, and so centrifugation, and so in case of your effusions are your sample is effusion and you have your watery lavage, then you concentrate it using you centrifuge to concentrate the sample. Okay, and so still if your sample is if enough sample is available, and so a cell block can be done and be processed as in processing microscopic slides for surgical specimen. No, and so with this, I actually did this one actually when I was an intern. No, and so you have here again, the sample is a plural effusion, no? And so the sample is a plural effusion. And so since medyo marami-rami yun, like the container of your NSS, normal saline, that is used actually in the hospital. Ayan, so yun yung vial na na-receive namin in the laboratory. And so the protocol is, and so in the hospital, I mean in the hospital where I had my internship is, what they call this, you mix at least, you have a two test tubes, and so you place equal amounts of 95% ethanol, and so you prepare two, you place 95% ethanol and 95% ethanol in that two test tube, and then of course you add equal amount of your sample. And so you add equal amount of your sample, and then you allow that you mix. Actually, you cover with a cover slip, and then you mix. You invert 2 to 3 times, and so you invert, and then you allow to stand. And so you allow to stand to form coagulum. And so you allow to stand to form coagulum, and then after some time you spin. And so after some time, you centrifuge, and so you centrifuge, and then you decant, and then you get the coagulum. And so you get the yes, you get the sediment, and then you place it in a yes, you place it in a what do you call this? You place it in a filter paper. No, you place it in a filter paper, and then you process. You process like you will like the process used in your surgical specimen. And then of course you prepare a cell block. And so you remove the what they call this, the filter paper, you place, and then you make a cell block. No? And then you cut, and then you still do you stain until of course you stain. And so that is for your in that is of course if you have excess sample. No? And so that is for your cell block. Balik na naman tayo sa vaginal hormonal cytology. Ano ba yan? Paulit-ulit na lang. Anyways, and so you have your vaginal hormonal cytology. And so this one, the sample, ayan, so is actually taken from upper lateral third of the vaginal wall. And so, but then actually your vaginal hormonal cytology actually is not usually used nowadays. No? And but then anyways, for that, and so let's talk about this. And so your vaginal smears are prepared for such a purpose are best for vaginal hormonal cytology are actually best taken from the upper lateral third of your vaginal wall. And so lateral vaginal wall. And so basta lateral vaginal wall. And so accordingly, because this one is more accessible and less likely to be contaminated by cellular debris or vaginal discharge. Okay, and so that lateral third of your vaginal wall is less likely, the sample is less likely to be contaminated by cellular debris or vaginal discharge. No, and so this one, and so to detect the presence of your RBC and leukocytes, and so you use your low power objective. Ayan. So your low power objective, and so used to detect the presence of your RBC, WBC, and the type of exfoliated cells. And so of course to assess the quality of smear and the staining, no? And then you have your rough. Ayan, so of course, for rough assessment of your proportion of mature superficial and pycnotic acidophilic cells. And so that is for your LPO. But then in your HPO, that is for your quantitative evaluation. Okay, and so of course, your quantitative evaluation. Okay, again, accordingly, ayan, so your vaginal hormonal cytology is not used nowadays. And so you've already prepared your smear, you fix them already. Then of course we're going to do your staining. And so for your staining or for your cytological staining, and so usually you use your Papa Nicolau stain. Okay, and so this is your Papa Nicolau stain. Of course, and so stain and to differentiate cells from your smears of various bodily secretions. Okay, and so of course you have here your combination of your stains. You have your hematoxylin, and so your hematoxylin here, it will stain your nucleus. And so it will stain the nucleus, your orange G, your orange green accordingly. And so that is orange G6, and so it will stain your keratin. And so this one originally your orange OG6, and so you originally used to stain the keratinizing cells of the squamous carcinoma in sputum. No, and so but then for this originally lang, but then now that is used to stain the keratin. Okay, and then you're using azure, and so that is your counter stain. And so you're using Y, and sustains the superficial squamous epithelial cells. And so your nucleoli, the cilia, and your RBC. And so your using Y stains the superficial squamous epithelial cells, nucleoli, your cilia, and the RBC. Ayan, so your reason why stains your, of course, that one again. Okay, and so that is for your Papa Nicolau. And then, of course, next you have your light green SF yellow. Ayan, so your light green SF yellowish and sustains the cytoplasm of your other cells, including your non-keratinized squamous cells. Okay, and so your light green SF yellowish stains the cytoplasm of your cells, and so including your non-keratinized squamous cells. And so, but then it is expensive, that is why, and hard to obtain, difficult to obtain. That is why you have here your fast green. You have your fast green FCF, and so that is used as an alternative stain. And so it's used as an alternative stain for your light green SF, yellowish, but then it produces a visually different results. And then, of course, your Bismarck brown. And so your Bismarck brown accordingly stains nothing. And so stains nothing. And for some formulations, and so it is omitted. No? And so that is for your Papa Nicolau stain. And so you have, please read on the modifications of this Papa Nicolau stain. And so the modifications naman is for the time. But then, and so please read on that. Okay? And so still in your Papa Nicolau, ayan, so your smear should display hues from the entire color spectrum. Ayan, so of course, from this entire spectrum of colors. Ayan, so you have the rainbow accordingly. No, ayan, so pagkatapos mo daw mag-stain, and so dapat may hue ng rainbow dyan. And so you have here your cell nuclei, unlike your cell nuclei anyways, your cell nuclei, and so it will be stained blue to black. Ayan. And then your cells with high content of keratin and glycogen, they should be stained yellow. Your superficial cells, they should be stained orange pink. Your intermediate cells and parabasal cells, they should be green to blue. And then your metaplastic cells should be green and pink. Okay. And so if varied yung staining mo, then of course, might as well check on your stains, no? And so your orange, green, and eosin azure. And so those stain lose their strength rapidly than hematoxylin. And so that is why this OG, your orange, green, and your eosin azure, and so should be replaced once a week or as soon as the staining of cells are no longer sharp, no? At your wet fixation and your air dried smear. And so in your Papa Nicolau stain, and so you have your wet fixation accordingly is time consuming and shows a drying artifacts and less retention of material comparing it to your air dried smears. No, and so but then your air dried smears accordingly, and so the cell size is magnified, no? And so cell size is magnified, and then the morphology of the cells is not script, not sharp, no? And so the staining of the morphology of the cells is not sharp, no? And so that is why there are actually modifications in this Papa Nicolau staining. And so to what we call this, to improve the staining quality. Okay, and so for that. Okay, and so let's take a look at your your cells seen in your cervico-vaginal smear. Okay, and so you have your cells, your parabasal cells. These are actually 15 to 30 micrometers in diameter, and they are round to oval with small dense basophilic cytoplasm. Okay, and so they are smaller than your intermediate cells, but with larger vesicular nucleus. No, and so they are smaller than your intermediate cells with a larger vesicular nucleus, and this one in that larger vesicular nucleus, and so this exhibit a fried egg appearance. Okay, and so your 2 weeks of this are seen, and so these are seen what we call this 2 weeks of age to puberty, after childbirth, abortions, and menopause. No? And so this one, they may be present in the proportions of which may determine the stage of sexual period and of sexual period of the patient on the time of ovulation. Okay, and then you have here your intermediate cells, and so they are medium-sized, polyhedral or elongated cells with basophilic vacuolated cytoplasm. And so that is for your intermediate cells. Illustration of your parabasal cells, and so basophilic cytoplasm accordingly. Okay, so you have your mature superficial cells, and so they are actually polygonal. Now, ayan, so it has a diameter of the cell has a diameter of 45 to 50 micrometers, and they are pale, pink staining cytoplasm and dark pyknotic nuclei. And so the nuclei of this one measures of at least 6 micrometers in diameter for the nuclei. Now, ayan, so it exhibits through acidophilia under the influence of your I sorry they exhibit true acidophilia, your mature superficial cells. Your true acidophilia here is actually characteristic of your superficial vaginal cells under the influence of estrogen. Okay, and so your true acidophilia is a characteristic of your superficial vaginal cells under the influence of estrogen. But then, and so this is a what we call this not reliable index of maturation. Okay, and so your pseudo-acidophilia naman, and so this is due to drying of your smears, prolapse, drying of your vaginal epithelium, infection, and chemicals. No, and so for your true acidophilia, that is due to your estrogen, and your pseudo-acidophilia, that is others. No, okay. Have here your what they call this an illustration of your superficial cells, and so you have it as acidophilia. No, your cells, you have your navicular cells, your boat shaped, and so they are boat shaped. Ayan, so intermediate cells with strong tendency to fold or curl on edges. No, and so this one, they are suggestive of combined estrogen and progesterone effect. No, and so the latter half of your menstrual, they are found on the latter half of your menstrual cycle, pregnancy, and menopause. And then you have your pregnancy cells. Your pregnancy cells, and so they are round, oval, or boat-shaped cells with translucent basophilic cytoplasm. And so again, they are round, oval, or boat-shaped with translucent basophilic cytoplasm and observed greatest at the center. And so you have here the what they call this your translucent basophilic cytoplasm is observed greatest at the center due to the glycogen accumulation. And so that glycogen accumulation will push the nucleus to the side or towards the cell membrane. And so this appearance accordingly is characteristic of your what they call this a deeper blue stain, characteristic of a due to a deeper blue stain of cytoplasm in the periphery. Okay, and so but then still you have a translucent basophilic cytoplasm, and they are round, oval, or both shaped. And then you have your endometrial cells, and so they are slightly cylindrical with less basophilic cytoplasm, and they are tightly packed. They are tightly packed groups of three or more, and so they appear, and so they are seen actually this one they are seen 1 to 10 days after menstruation. And so they are seen 1 to 10 days after menstruation. And they are shed in response to ovarian hormones. Okay, and so they are shed in response to ovarian hormones. Okay, and so that is for your have your endocervical glandular cells. And so you have your endocervical glandular cells. They occur actually in large group or small sheets. No? And so the cytoplasm of this is usually stained pale blue or gray and is finely vacuolated. No? Ayan, so finely vacuolated with indistinct should be indistinct cell borders and nuclei with finely granular chromatin. Okay, and so they appear they have this honeycomb appearance, and so they appear in they have this honeycomb appearance, no? Okay, and so you have your May Grunwald stain, and so there should be a dash here, no? And so but then this one is used for studying cell morphology in air-dried smears, no? And so cell morphology in air-dried smears, and so you have actually a for this one, and so your May Grunwald stain, and so it has a this one is superior for the study of cytoplasm, granules, vacuoles, and basement membrane, comparing it to your Papa Nicolau, no? And so it is superior comparing it to your Papa Nicolau. But then for your nuclear staining, May Grunwald is inferior is inferior to your Papa Nicolau in terms of nuclear staining. And so again, and so your Papa Nicolau is superior in nuclear staining. Okay, and so your May Grunwald gems stain is dependent on pH. The staining is actually dependent on pH. And so at alkaline pH, and so your alkaline pH increases a blue and acidic pH is pink or reddish tinge in stained specimen, no? And so at alkaline pH, you have a blue. At acidic pH, that is pink or reddish, no? In a stained sample.